Well, welcome to B303 Laboratory, B303 Lab. And I'm Professor Reichert, and with me is Tim O'Donnell, and we're going to give you a brief orientation to the laboratory as if you were a student coming into the laboratory, and we'd like to introduce you to all the features of the laboratory. So when you first come in as a student, one of the most important things is to sanitize the surface where you're going to be working. Okay, so this is your working space. This is a sanitizer. This kills both gram-positive and gram-negative bacteria. It doesn't sterilize the surface, but it reduces the number of bacteria on the surface. So the practice in the laboratory is to swab down your work area at the beginning and at the end of the laboratory to reduce any chance of contamination. So sanitization of the laboratory. Surface. This reduces the chance of contamination. There are different microorganisms that are used in the laboratory. We make the assumption that a lot of the organisms are potentially pathogenic, even though they may only be opportunistic in terms of their ability to produce disease. We treat all the organisms that we work with care and caution, so we try to control where they are. So, just to orientate yourself with respect to the laboratory, one of the most noticeable things are the inoculating instruments that we use to transfer bacteria. We'll be viewing a number of videos. There are two types of inoculating instruments: the inoculating needle, which has a fine point, you can see, and the inoculating loop. We will use both of these throughout the laboratory. You will see people use different techniques, but in some of the videos, you will see people sterilize the inoculating loop like this. I discourage people from using this technique. The reason the inoculating loop has a long handle is you can sterilize it like so. Okay, and you'll see in Tim's demonstration, one of the videos, the correct use for sterilization of the inoculating loop. Okay. Inoculating loop. Stains for staining bacteria, marking pencils, slides. Okay. Often we have to incubate bacteria at various temperatures. We have a room temperature incubator, a body temperature incubator, a walk-in incubator that we use. And then we have other incubators that we can set at various temperatures. Most of the time in the laboratory we'll be incubating our organisms in the walk-in incubator. In your case, for your take-home kit, you won't have a walk-in incubator at home, and I suspect that the top of your refrigerator will be one of the warmest and best places for you to incubate your organisms. We'll talk more about that later. So often we'll have microbiological waste to deal with. We have two containers that are designed for disposable pipettes and other materials that become contaminated. So maintaining the control of where we put contaminated substances is important in the laboratory. Okay, let's walk over here. So we have two basic discard areas, areas where we put sharps, areas where we put contaminated test tubes, and then contaminated petri dishes. So control of biohazard materials is extremely important in the laboratory. And it will be important in your own home. You'll have to be careful about the plates that you incubate so that different people don't have access to your incubating plates. So always keep that in mind. Make sure you incubate your plates in a safe location.